Hello and welcome to the program today. I'm your host, Neal Howard. Thank you so much for joining us here on Health Professional Radio. Our guest in studio is Dr. Richard Lipton, Vice Chair of Neurology and Professor of Psychiatry and Behavioral Sciences at the Albert Einstein College of Medicine, also Population Health Director at Montefiore Headache Center. And he's with us today to talk about the Chronic Migraine Epidemiology and Outcome Study, or CaMEO study, that looked at the differences between the way men and women react to migraine headaches. He presented those findings last month at the annual American Headache Society scientific meeting that was held in San Diego. Welcome to the program, Dr. Lipton.
Thank you so much.
Now, your specialty is in headache.
Well, so I'm a neurologist, so that's my medical specialty, but my subspecialty within neurology is headache medicine.
Were you the head of this CaMEO study, or were you just involved?
No, so I've directed the study, developed the surveys, and the study is a longitudinal web survey where we screened hundreds of thousands of Americans and identified a large group of people who had either episodic migraine or chronic migraine.
Did it focus on specifically the way that men and women, the differences between men and women as they relate to migraine, or is this something that was discovered as a result of the study?
Well, so the study had a broad focus. We wanted to look at differences between people with episodic and chronic migraine in terms of disease burden, patterns of treatment, comorbidities, healthcare utilization, and, we did have an interest in gender differences, but that wasn't the primary focus of the study.
Is this the first time that this study has been conducted in such an in-depth manner, or is this expounding on past studies?
Yeah, so we've known for a long time that migraine overall is more common in women than it is in men, and in fact 18% of American women and 6% of American men have migraine. We confirm numbers in that range in the CaMEO study. Frequently people look at that information and say, well, migraine's a women's disease because it's 3 times more common in women than it is in men. But it's hard to think of another neurologic disorder that affects 6% of the general population. So our perspective is that although migraine is more common in women, men suffer from migraine at very high rates, and viewing migraine as a women's disease has a number of negative consequences.
Are there ever any injuries that are involved with a migraine headache? And what exactly is a migraine headache? When does a headache turn into a migraine headache?
Right, so that's a common question. So migraine headaches are defined by both the profile of pain and patterns of associated features. So one hallmark of migraine is that the headaches are recurrent. People have repeated episodes over weeks or months or years of their lives. The pain is usually one-sided, usually pulsating, usually moderate or severe in intensity, and inevitably associated with some combination of other features. Those features might include nausea, sensitivity to light or sound, or characteristic neurologic manifestations like seeing spots of light or zigzag lines or experiencing tingling or numbness. And those neurologic features are usually referred to as auras.
So if it's something that you can see, like the spots or the squiggly lines, that is an aura. Anything that you see during a migraine is always characterized as an aura?
Well, so auras have characteristic features. They're usually visual, but they can be sensory and consist of tingling and numbness. They can be motor and consist of weakness, say, on one side of the body. But the overwhelming proportion of auras involve vision. It's important to say that if people have visual aura or sensory aura, they're much more likely to be diagnosed than if they don't have aura on the one hand, but on the other hand, most people with migraine don't have aura, and a major reason for underdiagnosis of migraine is the mistaken belief that aura is a required diagnostic feature.
Is this something that is often misdiagnosed, or are you saying that a misdiagnosis is usually attributed to that particular thing?
Well, so of people who have migraine in the United States, perhaps 65% have received a medical diagnosis of migraine, and if you ask them what kind of headaches they'll have, they'll say, well, my doctor told me I had migraine, but that leaves 35% who go undiagnosed. And one of the findings from our study is that men with migraine were less likely to be diagnosed than women with migraine, and that's one of the negative consequences of the belief that migraine is a women's disease. It leads to underdiagnosis of migraine in men because if doctors are thinking migraine is a women's disease, if they see a man with migraine, they may be more likely to miss it. Another factor that leads to underdiagnosis is the mistaken notion that Aura is required to make the diagnosis, when in fact only 20% of people or 30% of people with migraine have Auras.
Is there an age where migraine seems to be most prevalent, or is this something that can affect you at any age?
Migraine can affect you at any age, but prevalence peaks in the population in middle life between the ages of 35 and 55, and that's true in men and women. Migraine usually begins in childhood or adolescence, so it's a condition of early onset, and the fact that prevalence peaks so much later than migraine begins teaches us that migraine is a condition of relatively long duration.
What are the ways in which it presents itself in men and women? What are those differences? I've heard that women are more likely to be treated for a heart attack because they simply say, hey, I'm having a heart attack, whereas a man might excuse himself from the table and go die in the bathroom. And this is something that I've heard, nothing that I know for a fact. What types of behaviors alert a healthcare professional above and beyond the aura or the lack thereof?
Well, so for a variety of pain conditions, women are more likely than men to go to the doctor, and that's certainly true for migraine. So consultation rates for headache among women with migraine are higher than consultation rates among men with migraine. In addition to that, once someone makes it into the doctor's office, women with migraine are more likely to be diagnosed than men with migraine. Sort of surprisingly, if a man goes to the doctor and gets a diagnosis, diagnosed men with migraine are more likely to be treated than women with migraine, and women are more likely to be reassured without being offered treatment. And since migraine attacks can be disabling, and since the attacks can occur quite frequently, underdiagnosis and undertreatment of migraine in both men and women is somewhat problematic.
And in wrapping up, let's talk about the Headache Center.
Sure. So the Montefiore Headache Center was the first headache subspecialty center established anywhere in the world. It was established by a guy named Arnold Friedman to treat returning World War II veterans who had post-traumatic headache, and the center was established in 1945. Since then, the focus of the center has been on a much broader range of headache disorders, most commonly migraine and chronic migraine, but also cluster headache, trigeminal neuralgia, and a variety of other disorders. And we take an interdisciplinary approach. So, the center employs neurologists, health psychologists. We work with anesthesiology, neuroradiology, and many other neurosurgery and many other specialties, because we believe the key to effective treatment is accurate diagnosis. And although diagnosis is usually clinical, based mostly on a careful history and a neurologic examination. Imaging and other kinds of diagnostic modalities are sometimes quite helpful, and, it's a wonderful luxury to work in a subspecialty center with lots of expertise. The Montefiore Headache Center has a website which can be found simply by looking at montefiore.org and then going to the Headache Center. And the American Headache Society also has a website, and the American Headache Society is the leading professional organization in North America for healthcare professionals interested in treating headache disorders. We publish a journal cleverly named Headache, which is a high circulation journal which provides lots of information for headache interested professionals, and we do a couple of medical education programs every year that are national meetings, and then we do regional symposia for healthcare professionals who want to learn more as well.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. Richard Lipton, Vice Chair of Neurology, Professor of Epidemiology and Population Health Director of Montefiore Headache Center, and we've been discussing the Chronic Migraine Epidemiology and Outcomes Study, or CaMEO study, that looked at the differences between the way men and women react to migraines. Dr. Lipton presented those findings at the annual American Headache Society scientific meeting that was held in San Diego this past June. It's been a pleasure talking with you this afternoon, Dr. Lipton.
The pleasure was mine. Thank you so much.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.